What if the little things you think are just habits or personality traits are actually signs that your child needs help? Autism doesn't always look the way people expect, but noticing it early can make a difference in a child's life. Every day, parents miss the early signs of autism, not because they don't care, but because no one told them what to look out for. And for so many kids, that delay means missing out on the early support that can change the outcome of their lives. In this video, we are going to break the silence, break the stigma, and break down exactly what autism looks like from the earliest months of life all the way to adulthood. We are going to talk about the earliest signs of autism in babies and toddlers, how autism shows up differently across the lifespan, why early intervention matters, and what science says works, and also how to become part of the solution through compassion, education, and action. Whether you are a parent, an educator, a healthcare provider, or simply someone who cares, this conversation matters. So what is autism? Autism is a neurodevelopmental condition that can affect communication. It can affect social interaction. It can affect someone's behavior. It is called a spectrum because it presents differently in each person. Some may need daily support for communication or behavior, while others may function independently but struggle in social or sensory environments. According to the CDC, about 1 in 36 children in the US is now diagnosed with autism. That data is from 2023. But let me say this up front, not every behavior that seems different means a child has autism. Recognizing autism early makes a major difference, but the signs can be subtle at first. Here's a general breakdown based on developmental stages and current guidance from the American Academy of Pediatrics and Autism Speaks. In infants between 6 and 9 months old, you might notice that child rarely smiling, limited or no eye contact with their parents or caregivers, little back and forth interaction with sounds or facial gestures like smiling. In toddlers 12 to 24 months, you might notice lack of babbling or limited gestures such as pointing, waving, or reaching, not responding to their name, few or no spoken words by 16 months old, not using meaningful two-word phrases like, for example, I want juice by 24 months. At any stage, you might notice losing previously learned words or social skills, repeating words or phrases over and over, strong resistance to changes in routine or environment, avoiding eye contact or preferring to play alone, struggling to understand other people's feelings, having intense specific interests, displaying repetitive movements such as hand flapping, rocking, unusual reactions to sound, light, touch, smell, or taste. These behaviors don't always mean someone has autism, but they are signs that further evaluation is needed. Parents are often the first to notice when something feels off. Maybe your child isn't talking as much as their peers. Maybe your child doesn't respond to their name or prefers to play alone. These observations are incredibly important, but they are just the first step. It is natural for us to look things up online, join parenting groups, or talk with other moms and dads, but please hear me when I say this. Do not self-diagnose your child. Every child develops at their own pace. Some kids are shy, some are late talkers, others just have different learning styles. But if you notice repeated signs that concern you, the next step is not to diagnose your child yourself. You want to talk to a qualified healthcare provider like pediatricians, developmental specialists, mental health professionals, because they are trained to evaluate development holistically using evidence-based tools, not just isolated behaviors. Understanding these differences is important for providing age-appropriate support and recognizing autism in all its forms. Early intervention matters a lot. According to the National Institute of Mental Health, starting therapy early can improve communication skills, social skills. It can improve daily life functioning. The most effective interventions, they are tailored to the child's needs and may sometimes include speech and language therapy, occupational therapy for motor and sensory skills, applied behavioral analysis, which uses positive reinforcement to build useful behaviors. The earlier the support begins, ideally before the age of 3 years, the more the brain can adapt and grow. Early intervention can also help your child thrive in their own unique way. Let's talk about facing denial and delayed diagnosis. Many parents struggle with denial, and that is completely normal. It is hard to accept that something might be different about your child. Some families worry about labels, while others hold on to hope that it is just a phase. But the reality is, waiting delays progress. Developmental windows are powerful. Delayed support doesn't protect a child. It makes it harder for them to catch up. A diagnosis isn't a limitation. It is a gateway to resources, gateway to therapies, gateway to a community that can truly change that child's life. We must shift from asking what is wrong with this child to how can I support this child. For example, a child who flaps their hands may be self-regulating, not misbehaving. A teen who avoids eye contact might be focusing better when not forced to make it. An adult who prefers walking alone might do their best thinking in silence. Let's also change the language. Avoid using words like this child is weird, this person is weird, awkward, or badly behaved. Use words like sensitive, unique, or different. And to parents, you are not alone. There is joy, growth, and strength ahead. Seek support, take breaks, celebrate small wins. You and your child both deserve kindness and grace. Please remember, autism is not a tragedy. Ignorance is. Autism is not something to fear. It is something to understand. Healthcare providers, parents, when we recognize the symptoms, provide early support, create inclusive environment, we help people with autism live fuller and richer lives. If this message resonated with you, please like, share, and subscribe. Drop your thoughts or questions in the comments. I'd love to hear from you to keep this conversation going. Thanks, everyone.